I'm Dr. Semken, but please call me Keith when we talk afterwards. Um, I'm so nervous actually. So your guys' first two presentation is gonna go totally hand in hand with this whole optimal health, right? So one of the things that I do is I am a physical therapist and I help people heal. Now, this is the complete reverse of what I do. Usually people come to me and I sit down one-on-one, and now I'm coming to you. And so I'm completely out of my water and having fun. Now, one of the best things to do when you are nervous is to tell an embarrassing story. So one of the embarrassing stories that I have is I lived in South America for a few years. And when I came back from South America, I took a vacation with my dad up to the Indian reservation. Now, the worst thing that happened to me at the Indian reservation is I could not speak English to the Native Americans up there. So when I would go look and say, how much does this cost? I'd say, ¿Cuánto sale? And they'd be like, dude, we speak English. And I was like, ya lo sé. And they were like, seriously, dude, we speak English. And then I'd have to look at my dad and I'd be like, I don't know what's happening to my brain. My brain will not speak English to people that have darker skin. And it was the most embarrassing thing. And it took me about 3 days. And we did a whole bunch of hiking around there. And oh my goodness, was I ever so nervous. And it was embarrassing. So now we're friends because I've told you my embarrassing story. It's a really embarrassing story. Now, when it comes to anxiety and physical and emotional health, I will tell you, I did not become a physical therapist until I was 37. I started my journey of going back to school when I was 28. And so this program is really exciting for me. I did not know how this was going to go. And how did I come around to it? Well, I always loved physical activity. I was super great at exercising, super good at martial arts, kickboxing. I was a kickboxing champ back in 2003-ish, I think. But that has been my past, and I love helping people get better. So the question is, what is physical and optimal health? Is that okay?
Is that the right slide?
That is the right slide, but that is not the colors that I had on it. But that's okay. No worries. The important part is it is the condition of being sound in body, mind, and or spirit, or all three of them. I believe all three of them, right? So the question is, can we be in optimal health if we have really good physical health, but then our mind and our spirit is out of health? What do you think? Everyone's just got the, yeah. We're friends now, right? I told you my embarrassing stories, so shake your heads, nod, scream, whatever. So we can't. And the cool thing is, I really believe the more and more I have people come in to my room and sit down in front of me, that I realize when I listen to their physical problem, half of their problems are emotional or mental or spiritual problems. It's an amazing thing. And I'm sitting down and I'm like, this is a very easy physical thing to work out. Your knee hurts, let's strengthen it. But they've tried 2 or 3 different physical therapists and other chiropractors and other medical doctors, and they come to me and I'm really not that much better than anyone else. But when they sit down in front of me, I found that the one thing that I do is I listen, right? And one of the things about listening is I call it my 14-year-old, well, this might offend some of you 14-year-old girls, right? But I call it my 14-year-old girl syndrome, right? And I have this experience where I had a 45-year-old lady that fell when she was 14 years old. And she's had back pain since she was 14. She's had 2 or 3 kids. And I'm sitting there listening to her, and I'm like, how did you have 2 or 3 kids if you have back pain as extreme as you have it? She goes, I don't know, I just do. And so one of the things that I did is I sat down and I listened to her, and she goes, well, you know, the time that this pain actually started is when I was 14. And I said, well, what happened when you were 14? She goes, well, I was with a group of friends and I fell on my butt and it really hurt. But falls can be funny, and my friends laughed at me. And so I stood up and pretended like it didn't hurt because everyone was laughing. The next thing I know, she goes, I kind of got a little bit better, but every time I got emotionally worried or something, my back pain would come back. So she actually had on and off back pain for 20, 30 years. And she did have something physically wrong with her, yes. But once we kind of discussed her 14, now the weird thing is, this is not my department, right, of the mental side of things. And the fun thing is all of a sudden she realized half of her pain was only when she remembered the bad memory of when she fell down when she was 14. And so we started laughing about it. And then we took care of her physical part that she actually had wrong with her. And all of a sudden her pain was gone. I felt really cool, right? I was like, sweet, I helped someone with chronic back pain that had it for 20, 30 years. And the reality of it is we all have pain. Physical, emotional, and spiritual pain. And so what is health? It is freedom from physical disease or pain, right? Now, optimal health is all 3 of those combined. Now, the things that I work on is the neuromusculoskeletal health, right? So stretching and nerve mobility and strength. So one of the great things about pain is introduced by acidity. It's a hydrogen ion, right? Hydrogen ions, they just sit in the muscle cells, and we have these really specialized cells in our body that sense hydrogen ions or acidity in the body, right? And that will cause a physical pain to let you know, be careful, let's not get injured, right? Now, how does stretching and nerve mobility and strengthening help us with that? Well, one, does anyone know the definition of strength? Anyone have their phone out and want to look it up? Let's see how fast you guys are with your phones. Look up definition of strength. You got someone in the back. What's going on?
Strength is the quality or state of being physically strong, according to Oxford Dictionary.
Okay, physically strong? Does someone else have a different definition?
The second one is the capacity of an object or substance to withstand great force or pressure.
Oh, okay, I like that. That's my favorite definition of strength. Could you repeat that?
It was, sorry. Okay. The capacity of an object or substance to withstand great force or pressure.
So the capacity of an object to withstand pressure, right? So there's a lot of objects that can withstand a lot of pressure, right? And so one of the things when it comes to physical strength is how many times can you repeatedly move an object up and down, right? That's what we all think when it comes to physical strength, is how many times can we move it? Or can we just lift up this one really big object that's really heavy? one time, right? So, but strength is not just a physical thing, it's a mental thing, right? And we have to develop the mental and physical strengths of things, right? So how do you develop strength? Anyone know how to develop strength? Eat protein and work out. I like that. So that is how we get physically strong. How do you get mentally strong? Discipline, okay? So we have to eat protein and work out often, right? Okay, so what else? How do we get mentally strong? Creating good habits, great. Okay, so let's talk about learning. How do we become strong in math? Eat protein and work out? Yes, so practice, constantly practicing something, right? How do we get good at reading? We practice reading, right? So we have to keep practicing, right? Practicing is super important with everything because guess what? I am not very smart at math. I'm not. I never will be. I never plan on being a great mathematician. But guess what? I do have to help my kids with their algebra, right? I do have to help them learning their times tables. I still forget my times tables. I learned the tricks of nines, right? Drop a finger, right? Like count like 6 times 9, right? I still practice those little things because I'm not worried about that at my age of learning good math, right? But mentally, right? I'm becoming mentally strong when I help my kids with algebra. But guess what? The worst part is when my kids don't know and then I have to go online and then practice online and then go help my kids. But guess what? That makes me mentally strong, right? So we have to do little things in order to become strong. Now, the previous two discourses, right? They talked about anxiety and then moving on and just knowing where you're at. So it's okay that we're not perfect at everything. And I finally found that out, right? I'm like 45 years old. I'm old, right? Like, especially for you young kids, you know. Some of the other guys there were some older people here that they're like 45, that's young. But the reality of it is, strength happens a little bit over a little bit. We got to start somewhere. And so she got fired. She started at getting fired. But guess what? She overcame that little by little, right? And she was about to graduate when she got fired, right? How cool is that? That now she is a professional and she helps others get better, mentally strong, right? That's what her main thing is. So the cool thing, so when we talk about stretching and nerve mobility, right? Now, I'm going to show you how to walk like an Egyptian. Now, the older people in here actually know the song, but there's a song called Walk Like an Egyptian, but that's what I use in order to teach my nerve flossing, right? Now, why is this important? This is because this will help with pain, which I have a pain slide in the future, but this actually helps open up your nerves. So is what we're all gonna do, please. We're gonna put your elbow just a little bit above your shoulder, right? And then you're gonna say hi to people, and then we're gonna go with your hand completely backwards, and then you're gonna just rotate your wrist. And then what you're gonna do is you're going to straighten your wrist out as far as you can. Some people have greater mobility. Usually the younger ones can do this pretty easy. And some people can straighten it all the way, some can't, and that's fine. And then what you're gonna do is you're gonna very slowly take your opposite ear to your opposite shoulder. So it looks like this. And if you feel some tightness, you have some nerve tightness in your arm. And we just got to go nice and slow. And that is what nerve mobility is. Now that's part of the Egyptian. Now the other one is there's another nerve in there that we're gonna work. So we're gonna start at the same point, and then you're gonna point it towards your ear, and then you're gonna come down, and then you're gonna take your ear, and oh, I hear some people crying on that one. That's a good one. All right, and then you can kind of just move it back and forth. And then you let your hand down and you're like, oh my goodness, we got some movement through there. So that actually helps clear out some nerve mobility. So that was a nerve stretching. Nerves don't stretch, so we call it nerve gliding or nerve mobility. But that actually helps with pain, right? And strength training will help with pain and stuff as well. Cardiovascular health. I'm going to kind of mix that with the metabolic health because those things, everything for me just kind of starts going together. So cardiovascular health. What is cardiovascular health? Anyone know? Yes. So it's exactly how well your heart pumps, and then how well your heart pumps and gets oxygen into the lungs and then oxygen into your muscles, right? Now, how do you know if you're cardiovascularly fit? Anyone? What you got?
Your stamina.
Stamina, okay. Good, so stamina, what does stamina mean?
I mean, the first thing I think of is like being able to run for a really long period of time.
Perfect, that's the example of exactly what I was gonna use. How far can you run and can you do it for a long time, right? Anyone have friends in like the what do they call it, the cross country? Who does cross country in here? That's a man right there, just saying, cross country sucks. But it is so good for you, super, super good for you, right? Cardiovascular exercise is super good for you. And why is cardiovascular health so important? If you can see this, hypertension, insulin resistance, high triglycerides, cholesterol, right? Anyone know what vascular dementia is? Anyone know what dementia is? This kid know? All right, I'll ask you again.
It's like when you start forgetting things really easily. It's like a thing you get usually when you're older.
Okay.
Your brain starts to forget how to do things like breathing, walking, using the restroom, who people are, things like that.
Yes, so you forget things pretty easy, right? Now, what does vascular dementia, cardiovascular health, and metabolic syndrome all have in common? Anyone know? If you have metabolic syndrome, you're definitely not riding a bike or running or walking fast or climbing mountains, right? Now, vascular dementia, the reason why I talk about that is because it's something that's not going to happen until generally about 65. We can actually start seeing small symptoms of it about 50 years old, but at 65 is when people start to see it, maybe 70. Oh, grandma's just being crazy again, right? And oh, that grandpa, what's wrong with him, right? Like, why does he say that? He doesn't remember my name, you know? But what does vascular dementia do? So vascular dementia is all about having a little bit of the arteries start getting closed in your brain, right? Your arteries start getting closed in your brain, and then your brain is not getting blood to it, right? So vascular dementia, you know, hypertension. Hypertension actually is your arteries getting harder, right? So they're hard. So it's really easy to break, you know, very easy to break a glass straw, right? But the plastic straws from McDonald's, you can bend and then you can still suck through them, right? But you break a glass straw, you're not drinking any water, right? So how do we improve the metabolic syndrome, right? How do we improve and prevent disease in the future? Exercise, cardiovascular health. Now, how does mental health, cardiovascular health, and neuromuscular skeletal health, what do they all have in common? All right. So exercise helps prevent depression, right? I'll skip meditation and breath, and it improves quality of life, right? So we can have better quality of lives by exercising. But how does it do that, right? Now, there are medicines out there that help it. But what's the problem with medicines? This is my big thing. What is the biggest problem with medicines? What's that? Side effects? Dependence? Okay. Now, I have this really cool book that's like this big and that wide, right? And the book is called The Exercise and Its Mediating Effects on Cognition, right? Just big fancy word for what exercise does for the brain. Now, medicines is what medicine companies do in general is they say, they have the same book and they say, well, if this creates this and this creates this, what if we just create a medicine that only works on this portion? And then so now you take a medicine and it helps, but it doesn't work through the whole arterial cognitive tree, right? So exercise, cardiovascular exercise, will increase neuroadaptogens, nootropics, right? The one thing that I love is BDNF, brain-derived neurotrophic factor, right? That is things that increase brain power, right? It increases brain cells, it increases white matter, gray matter inside the brain. And so exercise, cardiovascular exercise, helps increase brain matter. Good, positive brain matter. It releases dopamine. It makes you feel good. It releases serotonin. And not only that, it releases it at a rate that your body wants. Generally speaking, because there's always the opposite. There's some people that don't. So it fights depression, right? And then I'll skip the whole meditation and breath part. Well, no, I have to see it because I brought an object for breathing. So one of the things that you can do to help yourself breathe is one, just breathe more through your nose. So close your mouth and only breathe through your nose. But this thing is a machine, and all it does is it has numbers on the sides, how much it takes to breathe in, how much it takes to breathe out. I won't be sharing this today. But all it is it helps increase your diaphragm muscle, which the diaphragm muscle is not only is a breathing muscle, it's a back muscle. So learning how to breathe through your diaphragm increases back strength. But all it is and doing that for 30 seconds can improve your mood. Crazy. I love this thing. I make everyone buy one that has any breathing problems or energy problems. All my people that have any difficulty breathing get that. People that are recovering from post-COVID that have mental problems, memory problems, getting the lower lungs filled with oxygen for some reason, we could talk to nurses and doctors about it on why it happens, but improves people's personality, mood, happiness, and we can go with that. Pain, I'll just talk about posture. Posture, we got to get out of bad posture. I'm not a big fan of saying there's bad posture, but there's this posture, and look at me try and take a deep breath. So sad. So guess what? All my pain patients come in with this posture, 100% of them. They come in, they're like, oh, I'm in so much pain, right? So how do we just start changing that? Well, one, and it's not about just straightening up the back, it's about getting the shoulders back and kind of just getting in alignment and then breathing through the belly a little bit, right? And all of a sudden, pain starts changing because when we have pain, we go into protective mode. And then we start with anxiety. And then we start with catastrophizing, right? And then we think, I'm never going to get better because I'm hurt. Just changing your posture can do this. And does anyone know about their power poses, right? Like you just stand tall, right? Superwoman and Superman pose, tall, increases testosterone, right? Just small little things. So just the breath alone helps pain. It's amazing at how much it does. Don't worry about being here, right? But when your mom says get out of that position, get out of it for at least 5 minutes, right? And then I always just tell my patients, just set a timer for 15 minutes. And every 15 minutes for the next, few days for your work week, you just hear a timer and you get out of bad posture for a while, right? We're all gonna sit like this. My patients always catch me sitting like this and typing on my computer, and I'm like, thank you. I get out of my bad posture for a little bit, and then we go back to it because it's comfortable. There's a whole bunch of reasons muscular-wise why that happens. What is the minimum exercise needed for optimum health? ACSM says between 30 and 60 minutes a day, moderate intensity for about 60 minutes, 5 to 6 times a week, or high intensity exercise 3 times a week. We'll discuss that when we start going into some exercises. And then cardiovascular testing, strength testing, daily exercises for optimum functional health. This is what I think that's what I'm gonna, okay, good. This is what I'm gonna finish with because I don't wanna, you guys are starting to, woo. No, but daily exercises for optimum functional health. My patients that have balance problems, they can't point their toes anymore. So not only can they not point their toes, when they're sitting on the table, they can't point their toes. So when they're standing, they walk like this and then they don't have any balance because they can't lean forward, because if they lean forward, they fall on their face, right? Because their toes don't point. So you gotta be able to get up on your toes. So one of the things I tell my younger patients that are starting to get pain, brush your teeth. And while you're brushing your teeth, get on one foot and brush your teeth, right? Do it with the opposite hand, very good for cognition. Being able to squat. We'll do some testing here in a little bit. Squat 30 times, right? We should be able to do it about 23 to 30 times in 30 seconds at our age, right? And if we can't do that, we need some help. And it's okay if you can't, but it's a place to start. We need to be able to do like farmer's carry, right, with half your body weight and just walk around for about a minute. Not only that, if you want to live a long time, you got to have strong hands, right? You want to live a long time, you got to have good cardiovascular respiratory, right? It's called VO2 max, right? And we're going to go over some of that in the next thing. So I will call it quits because I can talk forever on this. And so we'll go over it in the, what is it called?
The workshop.
The workshop.
Yeah.
So
Yeah.
we'll go over some of the exercise. I got some cool stuff and we'll go from there.
Great.
Thank you.
Thank you. Great job.